Bismillah ar-Rahman ar-Rahim. I am Dr. Yahya Wahba, Assistant Professor of Pediatrics and Genetics. Today I am talking about genetic counseling. It is an important topic of genetics. Definition. It is a process by which individuals or relatives at risk for a genetic disorder that may be hereditary are advised of the consequences of that disorder, the probability of developing or transmitting it, and the ways in which this may be prevented, avoided, or ameliorated. Who do it? Genetic counselors are graduates of an accredited master's degree program in genetic counseling. The American Board of Genetic Counseling serves as the accrediting agency for these graduate programs and also currently facilitate a board certification for individual genetic counselors. Genetic counseling is indicated in the following conditions: cases of stillbirth and neonatal mortality, children with congenital defects, children who are severely ill and where there is suspicion of inherited metabolic diseases, children with genital ambiguity or abnormal sexual development without hormonal etiology, children with neuropsychomotor delay or mental deficiency of an undefined cause or an obviously genetic etiology, children with deficient or excessive growth of undefined causes or with a suspected genetic disease, children with specific genetic diseases of an organic system, for example, sickle cell anemia, muscular dystrophies, advanced parental age, whether maternal age more than 35 years or paternal age more than 50 years, adult onset genetic diseases, it's called pre-symptomatic testing, as cancer and Huntington disease. Also, consanguineous marriage is an indication for genetic counseling. It is very important for autosomal recessive disorders. Teratogene exposure, including physical, chemical, biological agents. Heterozygote screening based on ethnic risks as thalassemia, Tay-Sachs disease, Canavan, and Gaucher disease. It is very important to screen for carrier status among certain population to prevent the disease as early as possible. What are the general ethical considerations in genetic counseling? At first, we should respect for people and families, including the whole truth, respect for people self-determination, and precise and unbiased information, preservation of the family integrity as much as possible, complete disclosure to individuals and families of all information relevant to health, protection of the confidentiality of individuals and families against unjustified intrusions on the part of employers, insurance companies, and schools, telling individuals that they have an ethical obligation to inform their relatives that they may be at a genetic risk, telling individuals that it is necessary for them to reveal their carrier status to spouses, partners, if the couple wishes to have children, and about the possibilities that their relationship may be damaged by these revelations. Also telling people they have a moral obligation to reveal their genetic status if it may affect public safety. Presentation of information in as an unbiased manner as possible. Use of non-directive techniques except with relation to treatment questions. Involving children and adolescents as much as possible in the decisions that affect them. What are the phases of genetic counseling? First phase is to define and to confirm the diagnosis. For example, in a case of Down syndrome, when we suspect a case of Down syndrome, we search for certain clinical data and we should confirm its diagnosis using karyotype. Also for diseases with genetic basis like cystic fibrosis or thalassemia, we at first diagnose the disease clinically will depend upon the nature of the parent. If the father is affected, all the sons will be free, and all the daughters are obligate carrier. If the mother is carrier and the father is normal, so the 50% of sons are affected and 50% of daughters are carrier. So calculating the genetic risk again is based upon our knowledge about the mode of inheritance of the disease, and also upon its genetic nature. Then we should communicate with the family and with parents about nature of the disease, risk of recurrence, possible complications, lifespan, and the life nature of their offsprings. Then we should help them in decision and action by opening for them the available decisions and not directing them to any one of these decisions. And the last step is to follow up the case and try to link the family with their supporting groups. We have many examples for genetic diseases, which could be good examples for genetic counseling. Marfan syndrome, it is an autosomal dominant. The risk of recurrence is 50% for normal, 50% affected. Cystic fibrosis, autosomal recessive, 25% will be normal, 25% will be affected, and 50% will be carrier. G6PD deficiency, if the father is affected, no sons will be affected and all daughters will be obligate carrier, while if the mother is carrier and father is free, the risk of recurrence will be 50% of sons to be affected and 50% of daughter to be carrier. Other example for X-linked dominant disorders, hypophosphatemic rickets. Here the condition is more frequent in females than males, but more severe in male than female. What are the outcomes and benefits of genetic counseling? At first, we provide information and data about the disease. This makes the father and the mother well oriented about the nature of their disease, the risk of recurrence, the complication, the lifespan, and the nature of their offspring. Also, immediate psychosocial support, because certain diseases like Down syndrome, like major congenital anomalies, it will be a catastrophe or a disaster for the father or mother, and we presence of genetic counseling immediately at this time give more psychosocial support. With long-term follow-up, the long-term psychosocial support come. Also, aiding in decision making is very, very important outcome and benefit of genetic counseling. Anticipatory guidance for the future offspring is very important benefit, and facilitating family communication to help affected families and caregivers to be oriented and gaining benefit from these supporting groups. Some of these supporting groups provide facilities for treatment, for diagnosis, for prevention of further offsprings to be affected. Is very, very important step and very, very important benefit from the process of genetic counseling. Thank you.